If you've ever been in a place where it's so quiet that it's loud, that's kind of the feeling. You have no sensation of anything going on. I want to hear. I want to be involved. I want to see everything and do everything.
The hearing loss is debilitating, it's frustrating, it's incredibly hard to deal with. Family gatherings, restaurants, around people, conversations going on, I was kind of in the background.
Sometimes kids, when you're wearing hearing aids, you're different, right? Well, we're not really that different. With a profound hearing loss, you are going to not be able to hear anything without any amplification. So with no hearing aid or cochlear implant in, the world is silent, to a point.
When it's time for a cochlear implant, typically the inner ear has a great deal of damage, which causes distortion to a sound, even when appropriately amplified. And what a cochlear implant does is it replaces the organ that is causing that distortion to restore some of the hearing ability.
The cochlear implant program is very close to my heart. It's one of my favorite procedures to perform because it is life-changing for our patients. Here at Henry Ford, we have a Cochlear Implant Center of Excellence. We have a multi-department team which looks at the patient as a whole person. Their first step is typically a hearing test or an audiogram with the audiologist, which shows us if a patient may have hearing loss severe enough to warrant a cochlear implant.
We present words from a speaker, we have patients listen with appropriately fit hearing aids, and if they only hear 50% or less of those words, it means they're a cochlear implant candidate.
They are going to be evaluated by our entire team, and that includes our otologists, sometimes our health psychologist, and sometimes other health professionals as appropriate.
Insurance approval for cochlear implants is a complicated process. The good news is insurance companies are changing their benefits for cochlear implants to be more open and inclusive of many more people with ranges of hearing loss. If an insurance company denies a patient's request for a cochlear implant or our request for a cochlear implant, we can help write letters, or we do something called a peer-to-peer, meaning we can pick up the phone and actually talk with somebody at the insurance company and help try to get coverage for patients.
The cochlear implant surgery has been performed since the late 1980s. It's done under general anesthesia and typically takes about 3 hours. The bone behind the ear is mostly hollow, so we open that bone up with a drill to get down to the inner ear. The implant goes through a membranous window into the bony inner ear, and the electrode coils into the cochlea, where it will send electrical signal for sound through the inner ear and nerve for hearing. We then tuck the receiver-stimulator under the muscle behind the ear and sew everything closed. In about 1 to 3 weeks after surgery, the patient follows up with the audiologist, and they attach the external processor and turn it on.
When we first turn a cochlear implant on, it may sound strange, artificial, robotic, usually not great. But what's remarkable is within a few moments, minutes even, the brain will start to recognize some of the sound. And 10 or 20 minutes into an appointment, patients will already be recognizing voices and words.
Right away, I could actually make out some words. It sounded really tinny and odd, but I actually was hearing through that ear for the first time in 10 years. And it was amazing, and basically I cried.
I think one of the things that's underappreciated about hearing is that it's something that you don't notice on a day-to-day basis until it's gone. And all of these things that we take for granted are really life-changing for our patients. They appreciate the world around them in a completely different way when they recover their hearing.
My experience at Henry Ford was fantastic. They were really willing to work with me. They were able to answer all of my questions. Their kindness and patience was invaluable.
Many patients will say to me, I couldn't believe what I was missing. I didn't realize how much I had withdrawn from my life or how hard I was working to hear, and I wish I had done this sooner.
Henry Ford changed my life. People told me that it would be life-changing, and it is. It's just incredible how much more and how much happier you are.
Henry Ford's done a lot of things, not just for me, but also for my family as well. We are very fortunate to have Henry Ford in the community. They've really given me the chance to just be more involved in life and to enjoy life more.